Hi, good afternoon, or good evening, or good morning, wherever you are listening to this podcast. It's my pleasure to start these podcast series on behalf of Revised Radiology and Teach Radiology. We are starting the new year with this new series to help radiologists in different stages of their career to learn different things that are useful for their career, starting from passing exams, doing the radiology training, but also to go through the phases of being a teacher in radiology and then practicing radiology. This podcast series will be of huge benefit to you. And it's my pleasure to have on the very first podcast Dr. Ram Vaidhyanathan, who is a consultant radiologist at the University Hospital of Leicester, which is in the UK. And he's also the vice president and president elect of the BSHNI, which is the British Society of Head and Neck Imaging. He's the RCR PK Ganguly visiting professor. Our relationship, if you like, our acquaintance goes back a couple of years now when we spoke about the anatomy for FRCR course, which is Dr. Vaidyanathan's brainchild, in addition to the well known Leicester FRCR course, which Dr. Vaidyanathan started and is now being run by his successors. So, my pleasure to have you on the call, Dr. Ram.
Thank you. Thank you, Koshy. It's my pleasure, actually, to be part of such a huge thing that you have built up, I should say, in a very short time. I think revised radiology has become kind of number one for any of the trainees when they look at how am I going to get through the exams, especially the UK radiology trainees. And spread your wings across into other countries as well, Egypt, India, Australia, Asia. I think having the two of us together here, or the two of the courses together, would hugely benefit a lot of our trainees in radiology.
Absolutely. I think we should start this interview by asking tell us a little bit about yourself.
I started medicine back in late 70s, so I don't want to show my age here, but then wanted to become a neurologist. And I did medicine, I did my membership, and then I realized that radiology was the way forward. And that's when I moved into radiology in the late 80s. And I think was the beginning of the 90s when head and neck was an upcoming subspecialty. I got very interested, moved sideways from neuroradiology and was appointed as a consultant in Leicester back in the late 90s, one of the first head and neck radiology consultants. On the back of it was always my passion and interest to teach, along with my other passion of anatomy. So the combination of the two led me to develop many of the courses that are very prominent today in the radiology trainees calendar, and also to imbibe technology as we go by. And that's what we have done. Get from the traditional light boxes showing the hard films to the Macs that we have in our Mac lab.
Absolutely. It's been an exciting journey, hasn't it? You've started a course just like we did as well. But what made you love anatomy? That is something that I am really interested in because anatomy was one of those things from medical school that I'm surprised I'm a radiologist.
When I look back at it now, 45 years down the line, I think it's your teachers, isn't it? I think
Mm,
I had some very great anatomy teachers. It was real. We used to do hardcore dissections. And for them to look at Cunningham's Manual of Anatomy, look at your Gray's Anatomy, and learn that gross anatomy was such a huge thing. And Obviously, I think, given my kind of family background, I think I was more tuned towards neuroradiology or
So
neuroanatomy.
tell when you say family
And
back,
my father, unfortunately, lost his battle to Parkinson's, which was d- diagnosed a bit late. But I realized there was so much more to neuroanatomy. I looked at the other side of it from a patient perspective. So I
yeah,
think that brought in a lot more, if you like, the way we look at
perspective.
perspective, or the way we look at medicine is, we look at it like a vocation, which is good. That's what it is. But when you're looking at it from a patient side, especially since it's your father, I think that brings in a slightly different dimension into the whole thing.
Yeah, that's right. And what would you say about trainees these days in terms of their focus on anatomy and their knowledge of anatomy?
I'm old school that way, but I think a large bit of the traditional old school teaching is lost today for various reasons.
Mm, yeah,
Rotational things, you're there for a very short time. COVID changed the whole things for us, which is where I think I'll come back to why we started anatomy for FRCR, is that we have lost that kind of a traditional way where you and me used to be sat in that, what we used to call the hot seat, and
yes,
put under pressure in front of your peer group, ask that difficult questions. Yes, it was difficult. There were days you sweated, there were days you didn't know the answer, but it made you tough. It made you go back, made you read about it.
yeah, yeah.
I am, as much as I am for the kind of virtual world that we are living in, replicating that kind of a situation, that kind of a thing is going to be very difficult.
Yeah, it is. And so tell me a little bit about the anatomy for FRCR course then that you set up. When did you set it up? Why did you do it? And you've answered a little bit about the why, but what's different about it?
If we go back to your own anatomy exams, when you did your first FRCR, we had this film viewing session, right? So we were led into a room with 30 light boxes, with each one had a film on it. And there was a question that was pasted at the bottom of that light box. And you had to move from one station to another 30 minutes. You had to answer those questions. 2009, I think 2010 was when the college kind of moved that into a more electronic platform. And it was
Yeah,
2010 the idea that we could actually run a course like this, very similar to what the college did when we were doing the exams, set in on the back of what we had already done with our 2B course. And we were very lucky to have about 16 Macs at that time, and the platform they were using was Mac. And so
yeah,
it was a no brainer to get that started. The first Leicester anatomy course started in January 2010, in the run up to the March exams. The story goes back that I was stuck in the US in an airport, and a chance meeting with a friend and a colleague, a radiologist in the US, led to kind of discussion about what we are doing and where we are in our stage of life, teaching and things like that. Led me to using webinars, or the kind of thing that was available at that time, as a teaching tool. So my friend in the US was already started using GoToWebinar as a platform to run courses for the American board exams. So I came back, rounded up a few of my colleagues, some of them reluctantly, obviously, on a Sunday afternoon, and said, "This is what we are going to do. I'm going to show you 10 cases of anatomy with an arrow, and I want you to answer those questions."
yeah, absolutely. And you also said to me that you let the candidates do the cases first as a test, and then you discuss around each image that was shown. So you've carefully chosen the areas that you're going to do for the test so that you can do a discussion.
Correct. Again, I think it's a if you look at the exam itself, when you look at the actual RCR website, the description of the anatomy exam says that most of the questions are easy. But if you actually put yourself in a trainee position, you start your radiology training in the UK in
Mm,
August, September, and you should be prepared to do the exams in March. Literally
yeah,
6 months down the line is a
yeah.
very short time for anybody to
It's
grasp that kind of breadth of knowledge.
yeah,
And I think that's where we said these are the key areas that the examiners are going to ask you. We are actually guessing what the examiners are going to come up with. And the way the exam is set up is you can answer the question, you might not get it right, but this is where the discussion session comes in.
mm,
We aid you as to how you could actually get to that answer, look at structures around it, because there's not one structure in that particular slide, and also show them in different orthogonal planes, different modalities. So the
mhm.
combination of everything brings it makes it a very useful tool, especially if you got 6 months to prepare.
Yeah, I think what's especially different with the way that someone like I trained for the FRCR, it was 2000 I think at 2003 was when I started
Correct.
radiology, and I can't even remember if I did an anatomy exam.
No,
I
I
don't
think it
think I
changed
did.
at
I
that
think
time.
I
I think
did.
it
I
changed.
think I only did a physics
Correct.
exam. Why there probably is a cohort like me who have not been very strong in anatomy. Okay, and I see that sometimes, even as an MSK radiologist, sometimes struggling with where are things. And the other thing that's changed is when we were learning radiology, we had textbooks,
Correct.
and you had to be able to understand and describe the way a particular nerve moved and be able to verbalize it. What would be the strategy that these the new batch of or new generation of radiologists, the way we have technology, we have websites like eAnatomy, we have a completely different way. You don't really need to know how to describe the way a nerve moves or a way a muscle moves. You even don't need to even know the actual insertion. And as long as you know what muscle you're looking at and you're a visual person, what would and you could get through the exam. That's what I'm trying to say. If you knew where things look by pattern recognition, you know that the gastrocnemius lies in this position, you can get a pretty good guess that's where it is. But how would you say people should prepare? If I was a new radiology registrar, just joined radiology, I've the only anatomy I've done is at models because we don't have dissection these days. I've looked at models, I've passed a basic anatomy exam in, let's say, Exeter University or somewhere like that, new generation universities, and my knowledge is a little sketchy of general anatomy. How would you learn radiological anatomy now as a new student? What's your
I
suggestion?
think let's go back to your original thing about you not doing the anatomy exams. There's a historical story behind it. The way they call it set out the first FRCR was the most difficult exams ever.
Mm,
You had 4 attempts to pass it, and if you didn't pass in those 4 attempts, you could not
you're out.
continue your radiology training. So my guru, Professor Cherryman, who was actually from Leicester, said, "Why are we putting this obstacle right at the beginning of somebody's career when we can look at it slightly differently?" And that's when the change occurred, when we didn't have the anatomy exams, but then they brought it back. It
Modular.
became
Yeah.
modular. To your second question, I look back at the way we learned anatomy. You referred to textbook. Weir and Abraham was the kind of the
Yeah.
Bible. If you could figure out the 40 little arrows that was there in that one image, I think your eyesight was very good, 6 by 6. But look at the way the technology has exploded. We've got so many resources today, free, paid for. various things, Twitter, social media, various
Exactly.
things that's giving us lots more opportunity to look at these things. But where we come in as a kind of course, or where we are helping, is trying to focus all that knowledge into getting into that kind of exam mode, get the exams out. Radiology knowledge, anatomy knowledge is for life. You're still learning them every day. If you look at how the technologies, radiology imaging technology has changed from the kind of 5 millimeter, 3 millimeter sections that we used to do, we have gone down to microns now,
0.75. Yeah.
which means
Yeah.
that you're seeing more and more structures, which means that you need to be up to date with your anatomy knowledge. So your anatomy knowledge does not end with the 6 months and the first FRCR exams. It stays with you for as long as you're a radiologist.
That's quite a daunting task when you think about it. And I wonder how many radiologists, including myself, actually take that into account, that we have to keep up to date. When we go for courses and conferences, we often go to pathology sessions. You know what I mean by sessions that show
Correct.
pathology. We don't go to, there are very few sessions in conferences about normal anatomy.
I think where it's personally for me, it's helped is being an head and neck radiologist. And unless you know your anatomy,
Yeah, exactly.
and a
Yeah.
very complex anatomy in a very small space. Just to give you an example, when we used to look at temple bones, we were quite happy. 2 millimeter, 3 millimeter sections, we
Yeah.
couldn't see so much there.
Yeah.
And
Yeah.
suddenly comes cone beam CT. Here we have got 350 micron sections.
Exactly.
And
And then you can people can see what you've missed. So if you stayed with the old technology, then you would miss quite a bit, won't you? Especially, for example, the inner ear and things like that. I'm sure you can see a lot more now than you could.
it just brings back that every new technology means I'm relearning my anatomy.
Oh wow. So that's a definite challenge, isn't it? So if I was a candidate and I wanted some preparation strategies, what would you say to me
I think,
for the exams
yeah,
career?
I think the question is you need to understand the exams. So the basic thing, obviously, anybody would have done would be to understand what the exam is all about. The RCR website is pretty good, especially the updated one. They've got the test platform as well.
Yeah.
And you're going to be, I think many of the
Light bulbs they call it. I think it's
it's
called
there.
light
I
bulbs.
think the light bulbs is their course that they're running, but they have already got a test to use the practic platform on which the
Yeah, yeah,
exam
yeah.
runs. You're already tuned to it, isn't it? And I think the second thing would be to look at each of the modalities that you're comfortable with. Some of them you're not comfortable with, some of the others. So to concentrate on things which you're not comfortable with. I find people, especially many of the trainees, head and neck, the kind of cardiac side of things, where there are more questions these days, those are things that you want to focus upon.
Mm.
And I think there's the wide range of material available, again free. You
Where the
can quiz
anatomy is,
yourself, you can quiz your
quiz
colleagues,
yourself.
you can go that way. um, End of it, I think you need to have a broad range of stuff that you need to know for the exams, and then breaking it
Yeah.
into modalities helps you there.
And would you read a textbook if you were a new age, new generation radiologist?
Personally, I'm still a textbook because I'm old school, but
Yeah.
I think the resolution of the images, the number of, like we talked about, Weir and Ibrahim with about 40 things on their thing, is going to be very difficult.
Yes.
You
So
need
it's
high
more
resolution
experiential.
images.
We're talking about, so we're talking about experiential learning rather than reading and trying to imagine what where things are.
Correct.
Yeah. Yeah, absolutely. So, what do you think of the concept of studying together for an anatomy exam? Is that something that your registrars do,
I
and
think
something that because we've been able to simulate that for
I
FRCR2B,
think that's
and it's
very
been
important.
very
I
popular.
think that's very important. You sit with your own peer group and look at these things and say, wow, look at their knowledge. It wants you to be, it's human nature, I think, to be a bit more competitive, I think. How is that
Mm,
that X knew the answer that I didn't know about? And that I think is healthy.
mm. And going to the next stage, which is once you've passed your exam and you're, let's say, 5 to 10 years later, you're now a practicing radiologist. What would you do? You think there is need for refresher courses for the organizations like the British Societies and RSNA and or to be running refresher courses for anatomy, or is that considered, I don't know, too basic?
As an head and neck radiologist, I will say no, you need that. And if you look at most of our programs, I've been part of BSHNI for such a long time. I've been involved in organizing the annual their refresher courses. The first topic, if we break it down into regions and things like that, if you look, if you're doing, for example, a session on nasopharynx, the first thing I would, the first session would be anatomy and techniques.
Mm,
And I was in Orlando for the ASHNR in September. We organized the BSHNI. I was at the ESHNR in Malta. I tell you, each one of them always started with the basics. And
yeah,
that is anatomy, anatomy, anatomy.
that's how it should be. So there's obviously something there as a need in perhaps for general radiologists who don't go to specialists,
Correct.
but it's something that will definitely help you report better as well. In terms of effective study and revision aids, what is your view of people using resources like Anatomy for FRCR and Revised Radiology and simulating the exam experience? Is that overrated, or do you think people can manage without it? Maybe a bit of a leading question, but I think I just
I think this is a genuine question. If I was a trainee, would I say, my should I be
would
spend
you spend
would
money
I
on these
spend my
resources
money
and why?
on this? But I'll give you a good reason for it. Exams are necessary devils in our career. We need to get moving. You can't be stuck
Yeah,
at year one or year two and say, I'm not progressing because I've not got the exams. So there is that kind of slight motive that, yes, it's not that I'm going to learn all my anatomy in the 6 months or the 2 days of anatomy for a first year webinar, but the idea is that you want to get through that phase of exams and get to a stage when you say, they're all done. Thank you very much. Now I've got the time and money, probably, and the thing to learn a bit more in detail. So I think we want to get through the exams for a good reason. We want
yeah,
career progression. We want to move on to becoming a consultant.
that's right. For a subject like anatomy, and a lot of from MBBS times, from the time I had a very good anatomy teacher when I was in medical school. Her name was Mary Jacob. She passed
I know.
away very
Yeah.
recently from Christian Medical College. She was an inspiration, and she was one of a type. Very few people could inspire you to see anatomy in that way. How can we make anatomy much more fun? And do you have any stories, anecdotes, I don't know,
Yeah,
from your teaching
I
roles?
think
And
there's plenty. I think if you look at it, our actual slogan says, "Come join the fun," because I think anatomy should be fun. Unfortunately, there's so much emphasis that is put on wanting to learn that in a way where it's not been taught properly. And you were fortunate, I was fortunate to be taught by people like Mary. And I think there's a huge thing. It's just I've been teaching on the anatomy for a long time. Where can this get into a twist? You got two muscles. You got the medial pterygoid. You got the lateral pterygoid, and invariably, when you show it, you know, it's the other way around. But if you make it fun and say, look, lateral, short, fat, medial, long, thin, it
Yeah,
sits there. It makes it that
yeah,
much easier. And
yeah.
uh, uh, uh,
So using tools,
yeah,
basically, we're
absolutely.
using tools, aren't we, to help people remember. That's why we used to learn mnemonics, right?
Correct. Yeah, I mean, if you look at the "she looks too pretty," try to catch her type thing for the carpal
Yes,
bones was
yes.
where it all
For cup,
started, I
it.
think.
I still do it.
Yeah, exactly. As an MSK
Yeah,
radiologist, yeah, and I think that's where it is. It's the way you do it, and this is where we come in. When we do our discussion session, we give all these kind of tips to say, look, you're struggling with this, you don't know what it is. Let's figure out a way and say, at which level are you at? What plane
yeah.
are you at?
And
Can you recognize some
and what's going to help
structures? Yeah.
you?
You
And
don't know the answer, but you recognize some structures. Use
yeah,
that and try and figure out what the answer could be. Yes, probably you're guessing a bit, but that's understandable for somebody who is literally 6 months into their training.
absolutely.
Yeah,
So
yeah,
the kind
sure.
of structures they show will be probably quite obvious on
Most
a.
questions are straightforward. Most questions are straightforward. And it's just that kind of 20-25% that you need to focus on.
Oh,
Some of the things that we show a whole range of normal anatomical variants. Again, that's a big part of the exams because variants could mimic pathology
gee,
unless you know what is, like your os, whatever it is around the ankle joint or knee joint and things like that. Unless you know that it's a normal variant, invariably you're going to call that as pathology.
that seems to be the biggest issue when candidates come to uh, when radiology registrars come to their Part 2B rapid reporting exam. That really gets them into the territory of overcalling. It's when they call normal variants or things they think are normal variants because the college has taken out these normal variants, but people still think it's knowing what's normal is key for the rest of your career.
You hit that on the head.
Something around the future of radiology education. There's a lot coming in now. AI is coming in, and effectively, you can ask ChatGPT or any of those. You can ask it a question, and it'll teach you, hopefully, more or less correctly, because it trolls the web and gets answers. Radiology education is most likely going to change quite in a very revolutionary manner, like the rest of the world is at the moment, as a result of artificial intelligence. For example, with resources like DALI, you can create images to show a particular point. Do you have any insight as to how this might change radiology education?
I hope not. I think I'm at probably in my professional career by the time all these things come through. It is scary that with that, if you just look back at a teaching session with your consultant, with the professor there, that breadth of knowledge, the kind of mistakes they own made, all that comes into that. I don't think any chat GPT, any new thing can build that experience into any of these software. So the traditional way of teaching will, in my, at least I hope, will remain that much traditional.
Yeah.
It
So
certainly
as you say
helps.
there,
It certainly helps
yeah,
in giving you
it should be seen as an aid.
as an aid.
Yes. And especially because I think there are lots of people who believe that AI will replace a lot of things. But I think you used a very interesting term there. You said experience. And the problem is that AI can only base itself on the experience that people have written down. or
I
typed
mean,
into the web or research articles. There is a lot of experience that is not written down, that is not typed, that is felt, that is human connection, conversations we have that are not recorded anywhere. And therefore, I think the fear that radiologists won't have a job or education companies are out of business is completely gone, because we use it to help
yeah,
give more
yeah.
feedback and to help deliver the training, but it's only a help. There's nothing like face to face, even if it's over the web.
I think that's the bottom line. That the amount of gray hair on my head is a reflection of that kind of trauma that I have gone through my life in trying to learn. There have been some bad experiences. There have been some very good experiences. All that is, and that is distilled. That knowledge that you're passing on to the next generation, I think, is timeless. And I don't think you can put any kind of technology in that kind of a situation.
And I think that's it's an excellent perspective. What could you say as some encouraging words to people who are thinking about doing radiology and are worried about the fact that technology can do so much, but also about things like anatomy, physics, and the challenges of radiology? Do you have any encouragement for people who would be considering career in radiology in this time?
I was very lucky to be the radiology lead for the Leicester Medical School for 5 years. And today I see at least a dozen of my medical school cohort who are all radiology trainees or consultants today. And I think that translates into saying radiology is the future. Your surgeon colleagues want to learn radiology. Your medical colleagues want to learn radiology. Everybody wants to do radiology. In the ER, in the critical care setup, if it really, you need that much of input into radiology. Where you differ from these clinicians is having that kind of good knowledge of radiological anatomy, the kind of techniques that you can use to answer the clinical question that is being asked,
Question.
and
Yeah.
to, I think, again, image guided. I think that's changed our thing hugely in terms of dealing with things. When we used to do iotograms, we used to do peripheral angiograms, all that has gone out of the window these days. And we are
Yeah.
harnessing the power of, very powerful imaging tools today to look at. We've changed ourselves to doing CTAs and MRAs today instead of the traditional angiograms. And I think of a situation where a radiologist or a newbie is going to be worried about AI taking over their jobs. But I don't know. Maybe that may be an epitaph that might be written on my tombstone. I don't know.
What are your interests, Dr. Vaidhyanath? What are your other hobbies
Um,
apart from being a consultant radiologist and teaching and traveling around the world to deliver?
no, I'm a small man in that respect. I think, yeah, traveling is a huge part. I think going across, and we've been very fortunate to travel to many parts of the world. And my other big interest is taking teaching to areas where which doesn't have access. So I've been making trips to India regularly to teach radiology residents there. And at the
Yeah.
moment, we are looking at working with radiology groups in Africa, which I think is a huge area which needs our support today. I've been very fortunate to work with some wonderful colleagues across the world.
Yeah.
And you've heard of the Cortex Club, which is a kind of a free club that we started
Yes,
by
that's
Mohit
right. The
Agarwal,
RSNA.
and you've seen that yourself at the RSNA. And
Right.
again, I think we're trying to build that link with neuroradiology Ethiopia at the moment. And there's a lot of interest. Again, I think what we are doing in terms of this virtual teaching helps there, because as you can't go there physically ever so often, especially in the
Yeah.
back of what happened at COVID, you can still
Yes.
do a lot of teaching in a virtual setting, have that thing of going there when you can and teach them in person. And I tell you, the interest that is there, the hunger for knowledge that is there is huge. Uh,
And it's incredible because these people are in areas where they often have to pay for their own education.
Absolutely.
They're not so supported as the candidates in the NHS. Of course, there are issues with pay and all kinds of issues that are topical now. But I think the deal that registrars get during your training period and the opportunities in radiology after you become a radiologist are is amazing. Now, obviously, the the challenges that are going on at the moment is because of it's not just about radiology; it's across the board. So I think we are really fortunate here in the UK to be in a system which pays you even something and allows you to have a basic quality of life. And we are in revised radiology extremely passionate about helping people in many countries, which is why we have a scholarship program where candidates can get 50% off their subscription
Mhm.
and make it really affordable. We've even given 100% scholarships, and it's where depending on the need and the ability of and an interest in that person in learning and giving back. So we expect something back for learning, and there are lots of people who are benefiting from that. And the anatomy for FRCR resources and the course that we are running shortly is something I'm really looking forward to.
Now,
I think it's a historic partnership between two well-established courses. I think you've got a very well-established course, and it's taken us a couple of years to come to this point, and that's how these things are. And what would you say, just on a light note, would you say are the benefits of attending conferences in person? Because that's how a lot of our interaction has grown through networking, through meeting each other often. Is there anything else that you think you put on when you go to a conference? Do you have a perspective that you put on to help you fulfill your goals?
I think meeting people in person, having that kind of conversation, like you said, the key word is networking. It is difficult for many of us to travel. Traveling anywhere is not cheap. And to go there in person and have that kind of conversation with people, I don't think it's the same as much as you would have on a Zoom meeting or any of the virtual
Virtual.
world that we live in any format. And I would highly encourage people, if they can, to be there in person. But again, I think not to miss out if you can't. I think most of the learned societies these days are giving that opportunity to look at the course contents after the meeting and to utilize it, because I think there's that much knowledge that is coming out from there. So you don't want to miss it. But to me personally, I don't think there is anything that comes beyond going there, having that kind of personal conversation.
I absolutely agree. And that's something which I sit with a little bit of regret that much of my consultant career, I went to conferences just to try and learn. And it's incredibly difficult to actually learn a lot in a
Mm.
conference. The topics may not be what you're looking for, but you can certainly learn the huge benefit, if there is any, from COVID and the whole pandemic was that we now have extremely good video resources. The ECR has a fantastic video resource of all the lectures. So does the RSNA, and we have a big resource of FRCR related videos, and now we'll have the anatomy FRCR course. So I think that together with meeting face to face, I think could have a huge benefit on your career. Would you
I think,
say add anything to that
I
or
think you need to pick and choose the meetings that you want to go to. You look at the program, obviously,
yes?
is this something that interests me? Because no meeting is cheap these days, whether within the
No.
UK or elsewhere. and you add the travel, the kind of the other expenses that come with it. I don't think it's a cheap option. So I think a combination of the two, and there are plenty of resources. BSHNI started with their webinars at the beginning of COVID, and within about 12 months, we ran about 15 webinars inviting all the kind of world leaders, if you like, in head and neck imaging,
Mm.
and for free.
Yes,
And
that
absolutely, and I think you're not spending money there in to join a webinar. And many of them are recorded. They are available for you to view at your own leisure, if you like, later on. Not necessarily that you need to be in person. I think the combination of the two. But if you're just sitting in a virtual world, I'll worry a bit about it because you want that interaction, especially with good teachers.
absolutely. Yeah, so I just want to, is there anything else you'd like to tell our
No, I
audience?
think to reinforce what you said already, I think it's the combination of the two platforms is fantastic, and I think it'll augur very well for the radiology trainees, not just in UK but across the world.
Yeah, I just want to say thank you very much, Dr. Vaidyanathan, for taking this podcast and helping us launch it, really. And we are looking forward to having lots of episodes with a lot of interesting and varied faculty and consultants, and even in other areas as broad as wealth creation, personal development. We'll discuss a huge number of other topics in the coming episodes. So anything that's useful for a radiologist in his life and career. And I look forward to that. Thank you very much
Thank
again.
you. My pleasure.